What's up, everybody? It's Brandon here with Low T Nation, and today the topic of this video is going to be erectile dysfunction. We're going to talk a little bit about what it is and a little bit about our clinical approach to resolving it for most patients. So erectile dysfunction comes in a lot of different formats, if you will. There are blood considerations, there's vascularity considerations, there's musculature considerations, and there's psychological considerations as well. For instance, I had a guy call me not too long ago, and he literally was saying, hey man, I have no problem with my wife when I try to have sex, but this new girl on the side that I'm talking to, I'm having a problem with ED. And I'm like, you're not having a problem with ED, you're having a conscience, you know, like that's not ED, bro. And so we had a different conversation at that point, of course, but that just goes to show ED can present in a myriad of different ways. As we get older, one of the things that starts to happen, it's a proven thing. Our penises get smaller as we get older, just like most of our muscles do, because we don't use them as much. One of the primary ways the body keeps the penis healthy when we're young is with these nocturnal and morning erections. As we get older, and it's typically a really good sign of low T, or one of the many signs of low T, guys will stop having their nighttime and morning erections, and that is literally the workout for the penis, right? So if you've been working out in the gym and you stop going to the gym, all your muscles start to get smaller. It's no different with your penis as well. It becomes a little less responsive. And the way this stuff works is, especially guys that kind of spin on an issue, if you have an issue once or twice, then you start worrying about having the issue, and that worrying about having the issue causes the issue, right? So you create yourself a nasty catch-22. One of our primary approach initially, now there's all of these different oral medications, there's Viagra, Cialis, Levitra. There are a lot of nitric oxide boosters, which don't really do much unless you're only like incrementally like at the initial phase of some kind of ED issue that can kind of get you back to normal. But if you have an actual ED issue, we recommend always starting with the orals. We prefer the daily use Cialis for several reasons. Number one, if the half-life of, or just say the effective life of Viagra and Levitra is about 3 or 4 hours typically. So you have to time it right. You know, you can't be as spontaneous as you want to be. You've always got to keep a pill on you or whatever. If you're going out of town, did you remember to bring your bottle? Like all of those things, they can cause problems. And the other issue with that is to get an effective dose, a lot of times people have to take a big dose, and you know, these things are called PDE5 inhibitors. They are vasodilators. And to get the effective dose, a lot of guys have to take a big dose, and that rush of vasodilation causes a lot of problems. It causes headaches and blurred vision. For some people, it causes backaches, it causes reflux, it causes all kinds of issues. Some guys just turn beet red because literally every blood vessel and capillary in your face is vasodilating. Your eyes can get super bloodshot. So that huge rush of vasodilation from the big dose becomes a negative for a lot of guys, okay? Also, if you're just taking it as needed, which means once or twice a week, maybe once every couple weeks, you're not getting that therapeutic effect of those nighttime and morning erections that we need in order to keep our penises as healthy as possible. So we like the daily use Cialis. Cialis lasts about 72 hours in the body instead of 4 hours. And if you take the daily use, we're taking small doses, like 5 to 6 milligrams a day. That eliminates that big rush of vasodilation that causes most of the side effects. The other beauty of this is because it's always in your system. I mean, I take mine every morning. I've got a pill bottle right beside my toothbrush. I brush my teeth. I take my daily use Cialis, and I'm good to go. You know, I don't have to think about it. It just stays with my toothbrush, and if I go somewhere, my toothbrush always goes with me, so does my Cialis. I don't have to worry about keeping it on me. But the beauty of it, it's always in my system, always. So I don't have to worry about spontaneity. It's like if something comes up, if my wife and I have like an impromptu trip somewhere, it's in my system. I don't have to think about it, right? And not having to think about it is a big deal also, because thinking about it, like I just mentioned, causes problems for a lot of guys. So I get the benefit of all of the erections over the course of a week and a month and a quarter. You're talking hundreds and hundreds of erections at night and in the morning that you would not have had otherwise. And the therapeutic benefit from that is tremendous. It really adds up. It's like personal training, if you will, for your penis. It's like getting back in the gym and getting back into shape. So that's our first line of defense. And I'll be honest with you, and I'm making this number up right now, but that solves probably 90% of the issues. A lot of guys come to us and they're like, no, I've tried Cialis before. You know, it kills me, it gives me a migraine, it kills my back or whatever. And we always ask them, well, have you tried the daily use? And the guy goes, no, but I don't want to try it. It didn't work for me in the past because of the side effects. And it becomes like an arm wrestling match with that guy. I'm like, please just try it. We actually, every new patient, if they're interested, we give them a week's supply of it for free because it makes such a difference. And now Cialis is on label for all of these other issues like BPH and high blood pressure. It literally lowers your blood pressure. You know, it's healthy for your prostate. And there are some other things that are literally on label for it now. So the drug is a very healthy drug. You know, we try not to put actual pharmaceutical drugs in most people's bodies. We try to stick with bioidentical hormones, but this is definitely an exception, and it's a positive exception. I mean, this stuff really works. So the daily use is our first line of defense. Some guys just don't want it and they want to try something else. We also have a peptide called PT141. This works on the male side and the female side, but a lot of guys literally have the best erections they've ever had using PT141. So for guys that just want to try something, the downside of that, it is a subcutaneous injection. You know, the upside of it is for women that take it, there is, and this is research back. This isn't like just anecdotal on our experience or from our experience. But research shows there's a double effect for a lot of women, which means they will have twice the orgasms at twice the intensity. And what it does for just drive and libido in a lot of women is absolutely, I mean, you have to try it to believe it. I don't even want to try and oversell it because most people that buy one of these bottles from us, they never stop because their wife gets such a benefit. Now, if you're going to do that, please make sure to tell our practitioner so our practitioner can have the conversation with your wife. There are some things that can or that need to be addressed with this. It can increase blood pressure. It can cause nausea in some people. It's got to be titrated right and dosed right. But once you get the hang of it, man, what a game changer for couples. It's really like it's the honeymoon package for a lot of couples where the guy will get on the daily use Cialis, the woman will use the PT141, and they're 19 years old again when it comes to the bedroom, you know. So that's one of our plan Bs. For more severe patients, and these are patients that have like a nicked nerve during a prostatectomy and advanced stage diabetes, guys that have like penile fractures and Peyronie's disease and other issues like that, we can use a compound called Trimix, and that is it's three, and there's also a quad mix, but it's papaverine, phentolamine, and prostaglandin or alprostadil. Those are also vasodilators, and they're injected directly into the penis. But I mean, obviously that's not for everybody, but for guys that need it, it's a godsend because it almost always works, you know. And this works on guys that haven't had an erection in a year or 2 years or something like that. What a profound change when all of a sudden they can have intercourse again. You can even give this stuff to like quadriplegics and it works. Okay, so it is the rock star shot. Some guys use it just recreationally. We don't recommend it too much for that because it can, you know, again, it can cause problems. It's the #1 way to get a priapism, and that's the erection that lasts more than 5 hours or 4 hours. So you really have to know how to do that. We have a very precise way we get guys on this. We titrate up, we start in the clinic, we make sure they understand injection technique. There's definitely limits to that. You can't use it more than like 3 times a week, never more than twice in 24 hours. Like there's some rules to it, you know, but again, for guys that just either, you know, they say it's either Trimix or nothing, right? So in that situation, it's a godsend for those guys. We also have some more advanced therapies that are more therapeutic in nature, such as shockwave therapy. Maybe you've heard of GainsWave. We don't have the actual GainsWave equipment, but we have something incredibly similar to it, and that can be compounded with PRP shots, even some regenerative tissue allograft shots, formerly known as stem cells. And so we have a lot of options, but you know, everything I said past the daily use Cialis is like maybe 10-15% of our business, where the daily use Cialis gets most guys such a profound change that that's where they stop. They don't need to go any further, you know. And for some people, just testosterone alone will bring back those morning erections and those nighttime erections, and just that will tip the scale back into an optimal state of being when it comes to erection quality. So, you know, if your testosterone is low, that needs to be addressed up front, because if your testosterone is low, you've got more problems than just the bedroom, right? You got to protect your heart and your brain and your bones. You want to protect lean muscle mass. You want to keep as much abdominal and visceral fat off of you as possible. Testosterone helps do all of that, and it helps the bedroom as well. So if your testosterone levels are low, that's step number one. Then daily use Cialis is step number two. Then we try peptides. Then we try Trimix. And if a patient wants to go into those more regenerative therapies like the shockwave and the PRP, that's typically, we hold that off to the end, typically because they're expensive, number one, and they're just not, there's no guarantee they're going to work. We've given these therapies to several people, and they got nothing from it, you know. So I don't want to start with that ever. I want to start with what's most cost effective and what is most likely to fix the problem, and then we kind of progress through our protocol. So if you guys have any questions about this, don't hesitate to reach out to us, 866-FIX-LOW-T or lowtnation.com. Have a great day. Thanks.